Bismillahirrahmanirrahim. Quote of the day is give every day the chance to become the most beautiful day of your life. Assalamu alaikum everyone. I'm Dr. Shujia Chowdhury, PGR Community Medicine, and I'm going to present the topic of mental illness under supervision of Professor Dr. Saira Hussain. Learning objectives. In this session, we will have to understand the concept of mental illness and its impact on individual, identify the common type, causes and symptoms of various mental disorders, explain different diagnostic methods and challenges in diagnosing mental illness, describe the various treatment options that are available, including psychotherapy, medication, and lifestyle modification, recognize the importance of the mental health awareness and ways to reduce the stigma, apply knowledge of the mental health management strategies to support the affected individual, and we will have some recent updates and MCQs. Learning outcomes. After completing this presentation, participants will be able to define mental illness and then differentiate between various mental disorders, analyze the global burden of the mental illness and its impact on the public health, demonstrate the knowledge of the evidence-based treatment and prevention strategy, evaluate the role of the diet, exercise, and therapy in managing mental disorders, advocate for the mental health awareness, and support initiatives in the community. First of all, let's understand what is mental health. Mental health is defined as a state of well being in which the person can work productively, is aware of its own abilities, can tackle the normal difficulties in life, and is able to contribute to his or her community. So, definition of mental illness according to the American Psychiatric Association is mental health is a syndrome characterized by clinically significant disturbances in an individual cognition, emotion, regulation, or the behavior that reflects a dysfunction in the psychological, biological, or developmental process underlying mental functioning. Case study. 32-year-old male present with extreme mood swings ranging from the periods of the elevated energy, increased shortness, reduced need for the sleep, and impulsive decision making to the episodes of the profound sadness, fatigue, and suicidal thoughts. Background. He has a history of depressive episodes since early 20s. Recently, he experienced an episode of euphoria, including excessive spending and the risky behavior. No prior history of the substance abuse, but family history of the mood disorders. Recently, he also lost his job due to erratic behavior and interpersonal conflicts. The differential diagnosis is major depressive disorder, schizophrenia, borderline personality disorders, where the primary diagnosis is bipolar disorder. Diagnostic criteria used is DSM-5 criteria, having at least one manic episode lasting a week, alternating with depressive episodes. Assessment will include mood disorder question and clinical interviews. Management treatment, pharmacological treatment, mood stabilizer, antidepressants, psychotherapy, cognitive behavior therapy, family focused therapy, self-education, lifestyle modification, management, and avoidance triggers. Global disease burden for the mental illness. According to WHO, one in every 8 people in the world live with mental disorder, and 70 million people around the world were living with a mental disorder. In 2020, the number of the people who were living with anxiety and depressive disorder rose significantly because of COVID-19 pandemic. Initial estimates show there is an increase of 26% and 28% respectively for anxiety and major depressive disorder in just a year. In 2023, 280 million people were living with depression, including 23 million children and adolescents. Schizophrenia affects approximately 24 million people, or 1 in 300 people worldwide. In 2023, 14 million people experienced eating disorder, including almost 3 million children and adolescents, and 14.3% deaths of the worldwide are attributed to mental health disorders. Globally, 1 in 7 10 to 19-year-old experience a mental health disorder, accounting for about 15% of the global burden of the disease in this age group. Depression, anxiety, and behavioral disorders are among the leading causes of the illness and disability of adolescents. Suicide is the third leading cause of the death among people aged from 15 to 29, and more than 700,000 people die every year by suicide, which is one person every 40. This shows the prevalence of the mental and substance use disorder. 2017, the anxiety disorder account for about 50% prevalence, followed by depression, alcohol use disorder, use disorder, bipolar, schizophrenia, and eating disorders. Classification of mental disorders. There are two widely accepted classification systems for the mental disorder, ICD and DSM-5. ICD stands for International Classification of Diseases, and DSM-5 stands for the Diagnostic and Statistical Manual of the Mental Disorders. However, there are certain differences between these two. ICD is developed by the Global United Nations Agency, and DSM is developed by a single national association. ICD is free, open source for the public health benefit, while DSM provides large portion of the American Psychiatric Association revenue. ICT is for the country's service provider, while DSM is for US behavioral health. ICT is global, multidisciplinary, and multilingual, while DSM is US Anglophone perspective. ICT is approved by World Health Authority, while DSM is approved by APA Board of the Trustees. ICT covers all the health conditions, while DSM covers only the mental disorders. Now, the Diagnostic and Statistical Manual of Mental Disorder (DSM) is a classification system developed by the Psychiatric Association to standardize the diagnosis of the mental health condition. The latest version is DSM-5, which categorizes the mental disorder based upon the specific diagnostic criteria and accuracy in the clinical practice. According to this, there are various types of the mental illness. Some of them are neurodevelopmental, schizophrenia, bipolar and related disorder, depressive disorders, anxiety disorders, trauma and stress related disorder, obsessive compulsive disorders, and substance related and addictive disorders. Let's start with one by one. Bipolar disorder. Bipolar disorders, people with a bipolar disorder experience alternating depressive episodes with a period of manic symptoms. During a depressive episode, the person experiences depressive mood, feeling sad, irritable, or empty, or a loss of the pleasure or interest in the activities for the most of the day, nearly every day. The manic symptoms include euphoria or irritability, increased activity or energy, or any other symptoms such as increased talkativeness, racing thoughts, increased self-esteem, increased need for the sleep, distractibility, and impulsive reckless behavior. Anxiety disorders, which include generalized anxiety disorder, panic disorders, or the social anxiety disorders, they are characterized by the excessive fear and the unrelated behavioral disturbances. Generalized anxiety disorders are characterized by the excessive worrying. Panic disorders are characterized by the panic attacks. Social anxiety disorders are characterized by the excessive fear and the worry in the social situation. And separation anxiety disorders are characterized by the excessive fear and anxiety about the separation from the individuals to whom the person has a deep emotional bond and others. Obsessive compulsive and related disorders. OCD is a chronic mental health disorder which is characterized by the persistent unwanted thought, obsession, and repetitive behavior. Compulsions that interfere with the daily functioning. The symptoms include obsession. These are the intrusive thoughts like a fear of containment, excessive doubt, and a need for the symmetry. And their compulsions, which are the repetitive behavior like excessive hand washing, checking, counting, and arranging objects. Anxiety and distress if compulsions are not performed, and impairment in the daily activities and even the relationships. And the stress related disorders that include PTSD, acute stress disorder, and adjustment disorders. PTSD may develop following exposure to an extremely threatening or horrific event or a series of the event. It is characterized by all of the following: re-experiencing a traumatic event or event in the present, intrusive memory, flashbacks, or nightmares, avoidance of the thoughts and the memories of that event, or the avoidance of the situation or activities or the people who are the reminiscent of that event. Increase in the PTSD symptom severity was associated with an 18% increase in the risk of the chronic heart diseases. Depressive disorders that include major depressive disorder, persistent depressive disorder, and a seasonal affective disorder. Depression is it's different from the usual mood fluctuation and short-lived emotional responses to challenges in everyday life. During a depressive episode, the person experiences depressive mood, feeling irritable, sad, or empty, or the loss of the pleasure interest in the activities for the most of the day, nearly every day for at least 2 weeks. Several other symptoms are also present, which may include poor concentration, feeling of the excessive guilt or the low self-worth, hopelessness about the future, thoughts about dying or suicide, disturbed sleep, changes in appetite or weight, and feeling especially tired or low in the energy. People with depression are at increased risk of suicide. Schizophrenia. Schizophrenia is characterized by the significant impairments in the perception and the changes in the behavior. The symptoms of the schizophrenia are both the positive and the negative spectrum. The positive psychotic symptom delirium, and the positive disorganization symptom, disorganized speech, thought language, thought disorder, characterization, thought blocking, loosening of association, disorganized behavior. And negative symptoms range include elogia, which is the poverty of the speech, flat affect, poor attention, avolition, loss of the motivation, anhedonia, lack of the play, and the loss of the social interest or the attention deficits. People who are living with a schizophrenia have a life expectancy 10 to 20 years below of the general population. Eating and the eating disorders that include anorexia nervosa, bulimia, and the binge eating disorders. Eating disorders such as the anorexia, bulimia, and abnormal eating and preoccupation with the food, as well as a prominent body weight and a shame concern. The symptoms of the behavior result in a significant risk or damage to the health, significant distress, or the significant impairment of the function. Anorexia nervosa often has its onset during adolescence or early adulthood and is often characterized by the premature death due to the medical complication or suicide. Individuals with a bulimia nervosa are at significantly increased risk of use, state, and the health. Causes of the mental illness. There are certain risk factors which include genetic, biological, lifestyle, or the environment. We will discuss them one by one in detail. Biological factors include both the genetic and the brain capacity. Genetics are the family history of the mental illness, which can increase the risk. Certain genes may make the individual more susceptible to the condition like depression, bipolar, or schizophrenia. The brain chemistry, like imbalances in the neurotransmitters, are linked to the mental illness. For example, depression is linked often associated with the low level of the serotonin. Trauma and stress exposure to the traumatic events such as abuse, neglect, or avoidance, especially during the formative year, can significantly impact the mental health. Chronic stress from life circumstances can also be a major factor. Factors, hormonal changes or imbalances, especially during the puberty, pregnancy, or the menopause, can affect the mental health. Socioeconomic factors, unemployment, poverty, or the poor living condition or literacy also cause mental illness. Medical conditions like chronic illness, neurological disorders, or other health problems can have secondary effect on the mental health. For instance, conditions like multiple sclerosis or thyroid disorders can have a psychological impacts. Substance abuse or the sexual abuse, abuse of the drugs or alcohol can trigger and exacerbate the mental health issue. Some substances can alter the chemistry of the brain, leading to a worsening condition like anxiety or depression. Environmental factors like trauma, stress, death, or divorce, living conditions, including exposure to the toxins or the lack of the social support, can affect the mental health. Stressful life events such as losing a job or experience a major life change can also a contributing factor. The generalized signs and symptoms of a mental illness include the sleep or appetite changes, mood changes, feeling disconnected, nervousness, unusual behavior, changes in the school or the work, illogical thinking, loss of interest, and diagnosis of the mental illness. The process of assessing the signs and evaluating the disorder by the psychiatrist, psychologist, and the general practitioner. Methods of the diagnosis include the mental status examination, clinical interviews, psychological testing, physical examination, third-party reports like family, friend, or from the other professionals. The structured diagnostic approaches include DSM-5, as already discussed, and ICD-11, and HONOS, which is the Health of the Nation Outcome Scales, which is used in the UK mental health services. This is the mental status examination, which includes the appearance, attitude, and behavior, mood, and perceptual disturbances, thought form, thought content, cogniting, and sensorium, and insight and judgment. Any mental state examination is a series of the 11 questions ready to allow to check the mental illness. Objectivity and bias, reliance on the clinical judgment, time-based, time and budget constraint, limited assessment, comorbidity, multiple disorders in one person, culture and regional variation, differences in symptoms and classification. Future of psychiatric diagnosis, advancement and challenges. Neuroimaging and the brain biomarkers, MRI or the functional MRI. Researchers are exploring the brain scans to identify the patterns which are linked to the psychiatric condition. Potential to detect the structure and functional abnormalities in disorders like schizophrenia, depression, and PTSD. However, the large-scale studies are still needed to validate the reliable biomarkers for the clinical use. EEG or electroencephalography, it measures the brain activity and may help in detecting the condition like ADHD and epilepsy-related psychiatric disorders. It is less expensive, non-invasive as compared to the MRI. Artificial intelligence and the machine learning. AI in mental health diagnosis. AI can analyze the patterns in speech, text, and the facial expression to detect the early signs of the mental disorders. Machine learning model trained on the large dataset may improve the diagnostic accuracy. Chatbots and the digital mental health tools, while not a replacement of psychiatrists, they can assist in screening and early intervention. Smartphone-based mental health diagnosis and the apps which use passive data collection like sleep pattern, typing speeds, voice tone to assess the mental health. Examples include the mood tracking apps which are used to monitor the symptoms and alert the users about their potential depressive episodes. Genetic and the biological markers. Personalized psychiatry advances in genomics suggest that the certain genes may be linked to the mental disorders. Genomics can help predict whether the medication will work based upon the individual's genetic makeup. Blood tests for the mental disorder. Some studies suggest that the blood-based biomarkers, like inflammatory markers, may help diagnose the condition like a major depression or the bipolar studies. Still, it's early stage of research, but it can be a promising thing in the future. Management of mental illness. Mental health management includes the medical, psychological, and the lifestyle intervention. Treatment can occur in the hospital, clinics, or the community-based setting. Recovery-oriented approach support individuals in achieving a fulfilling life. The types of the mental health treatment include the lifestyle modification, psychotherapy, medication therapy, or let's discuss them one by one. Lifestyle modification. It includes exercise. Exercise improve the mood, reduce anxiety and depression. Dietary changes, nutrient-dense diets like Mediterranean diet, low mental health risk. Quitting smoking and reducing alcohol, it also supports the brain health. Sunlight exposure and vitamin D help in the mood regulation. Role of the diet in the mental health. Nutritional psychiatry focuses on how the food will affect the mental health. Gut-brain connection, diet affects the neurotransmitters like serotonin or dopamine. Mediterranean diet benefit, it is rich in the fats and the fibers and the micronutrients good for the mental brain health. Processed food and the sugar are linked to the high risk of depression and anxieties. Psychotherapy or the dog therapy, it includes the cognitive behavior therapy, which helps changes the negative thought patterns. Dialectical behavior therapy, which is useful for the emotional regulation. Family and the interpersonal therapy, which focus on the relationship. And humanistic and psychoanalysis, which address the deep-rooted emotional conflicts. Psychiatric medications include antidepressants, which are used to treat depression and anxiety, and anxiolytics or sedatives, which reduce anxiety and insomnia. Mood stabilizer, which manages the bipolar disorder, antipsychotics, which treats schizophrenia and psychotic disorders, which stimulants, which are commonly prescribed for the ADHD. However, certain challenges, including with psychiatric medication, include the side effects of the medicine adherence and the overuse concerns. The other treatment options include the electroconvulsive therapy, ECT, which is used for the severe depression, creative therapy like using music, art, and drama therapy, psychoeducation, helping the patient understand and managing their own condition, peer support and counseling, emotional support from the trade profession, emotional support animals, providing the comfort and reducing the anxiety, supported housing and employment to help reintegrate the individuals into the society, self-help and the peer group community-based recovery support. For the prevention of the mental health, the first one is the primary prevention. It is the stopping the mental health problems before they even start. For example, if we have a certain risk factor identification like hectic life schedule and sedentary lifestyle, it should be replaced with the meditation, religious activities, or the exercise. Academic failure and scholastic demotivation should be uh, replaced by the good parenting, family conflict or the family disorganization by the positive attachment or the early bounding. Um, Exposure to the aggression and violation and the trauma should be replaced with the stress and conflict management skills, school psychological counselor support. Loneliness and the cultural shock should be replaced with the pro-social behavior. Medical illness, neurochemical imbalance, or disability should be replaced with the medical and surgical support. The secondary prevention include the diagnosis and the proper treatment. The early diagnosis include the screening programs in the schools, universities, industries, recreation centers for the early diagnosis of the mental health, screening of the substance abuse disorders. Pay attention to warning signs, get routine medical checkups, not hesitate to ask for help. Treatment include pharmacological, psychotherapy, group therapy, cognitive behavior therapy, biofeedback therapy, creative therapies, electroconvulsive therapies, vagus nerve stimulation, transcranial magnetic stimulation, and surgical problems. For the tertiary prevention, it targets those who have mental illness and help to reduce the severity, discomfort, and disability which is associated with their illness. It aims to reduce the people's symptoms, empower them to manage their well-being, and reduce the risk of their illness. The strategies include preventing complications of illness, promoting rehabilitation that is directed towards achievement of the maximum level. The therapies include the CBT, which focus on changing the negative thought patterns and behavior. Dialectical behavior therapy, which is a form of a CBT that emphasizes the emotional regulation and mindfulness. Psychodynamic therapy, which explore unconscious process and past experience that influence the current behavior. And interpersonal therapy, which focus on improving the personal relationships and communication skills. This again shows the tertiary prevention, which is the disability limitation by the family support, counseling, complication, compliance with the long-term medication and de-addiction. The rehabilitation, which can occur by the social and family support, workplace accommodation, community residual service, coping skills, support, employment, and institutionalization to reduce the potential stressor and create a social support and developing skill in social interaction within the individual. Stigma and discrimination against the mental health. There is a widespread and a long-standing stigma which is associated with the mental distress and unusual perceptions within the society and the mental health services themselves. Persons with the psychosocial disabilities are commonly believed to be the violent and dangerous, a stereotype that is consistently reinforced by the media. Stigma often comes from the lack of the understanding or the fear. It includes the negative and discriminatory attitudes of the people and can contribute toward the worsening of the symptoms and reduce the likelihood of the getting a treatment. It's very important to reduce the stigma related to the mental health. The National Alliance on the Mental Illness offers some suggestions about how individuals to help to reduce the stigma of the mental illness. The certain points include mental health, such as sharing on social media, educate yourselves and others, response to the misconception or negative comments, and sharing the facts and the experiences. Be conscious of the language, remind people that the word matters. encourage equality between the physical and mental illness through a comparison to how they would treat someone with cancer or diabetes. Show compassion for those who have the mental illness. Be honest about the treatment. Normalize mental health treatment just like any other healthcare treatment. Let the media know when they're using the stigmatizing language, presenting stories of the mental illness in a stigmatizing way. And choose empowerment over the shame. I fight the stigma by choosing to live an empowered life. Caring for your own mental health is very important. Mental health includes emotional, psychological, and social well being. It is not just the absence of a mental illness, it is essential to the overall health and the quality of their life. Self care can play an important role in maintaining a mental health and support the team and recovery if you have a mental illness. Self care means taking the time to do the things that help you live well and improve both your physical and the mental. Certain self care tips include getting regular exercise, eating healthy, regular meal, and staying hydrated. Make us sleep a priority, focus on positivity, and stay connected. Importance of the mental health awareness is very important. It's crucial to spread the awareness about the mental health to reduce the stigma. Awareness helps break down the stigma in misconception that is often surrounded by these conditions. Encourage the early intervention. People understand the stigma and symptoms around a mental health issue. They are more likely to seek the help, lead towards an effective treatment and better outcomes. Promoting the support system, increasing awareness fosters an environment, supportive environment where the individuals can find empathy and resources. This support can come from the friends, family, or the workplaces. Encouraging self care, understanding mental health, and empower individuals to take proactive steps towards managing their well being, such as practicing mindfulness, seeking therapy, or engaging in the healthy coping strategies. Clinical response to the mental illness include the early childhood interventions, programs for the mental health, maternal mental health, parental support in the child development, school-based initiatives for the mental health training, counseling service, emotional support program, work-based mental health policy, stress management, flexible work options, and the employee assistance programs. Expanding mental health service that includes ensuring availability of the psychiatric psychologist and doctor, affordable treatment options, insurance coverage for the mental health services. According to WHO World Mental Health Atlas in 2020, only 49 countries have integrated mental health into their primary healthcare system. The median number of the mental hospitals per 100,000 population range from below 2 in low-income countries and over 25 in high-income countries. Outpatient visits per 100,000 population range from 100 visits in the low-income countries to over 500 visits in the high-income countries. The child and adolescent inpatient facilities is less than 0.5% per 100,000 and less than 2 outpatient services per 100,000 population. 112 countries report that 0.64 community-based mental health services per 100,000 population. There is an extreme variation between the income groups. To cope up with this problem, WHO has a comprehensive mental health action plan from 2013 to 2030. It recognizes the essential role of the mental health in achieving the health for all. The plan includes four major objectives: to strengthen effective leadership and governance for the mental health, to provide a comprehensive, integrated, and responsive mental health and social care services in the community based setting, to implement the strategies for the promotion and prevention of the mental health, to strengthen the information system, evidence, and research for the mental health. WHO Mental Health Gap Action Program (MHGAP) use evidence-based technical guidance, tools, and training packages to expand the services in the country, especially who are in the resource-poor setting. It focuses on prioritized set of the condition, directing capacity building towards non-specialized healthcare providers and an integrated approach that promote the mental health at all the levels. The WHO MHGAP Intervention Guide 2.0 is a part of this program and provides guidance to doctors, nurses, and other healthcare providers in non-specialist health settings on assessment and management of the mental health disorders. Along with this, the PARO Declaration on the Universal Access to the People-Centered Mental Health Care and Services. It advocates for the revolutionary challenges in mental health care, prioritizing the well-being over the disease-centered approaches. Key transformation include making the person-centered care, shifting the focus from diagnosis and treatment to prevention, lifestyle and early interventions, community engagement, empowering individuals and communities, holistic approach, adopting a biosocial model, recognizing mental health play an important role in biological, psychological, and the social factors, in decentralized care, moving from tertiary care to the community-based hours. Achieve these goals, WHO Southeast Asia region member states have urged to develop multi-sectorial policies that address the mental health risk, life courses, and reduce treatment, ensuring accessible services without any financial hurdles. As a positive response, at least 717,477 children and adults have received treatment for the mental, neurological, and substance use, most for the first time in their life. More than 59.8 million people have access to the mental health services in their communities now. 34177 individuals trained in practices related to the mental health and psychosocial support. The World Mental Health Day is celebrated each year on 10th October to raise awareness about the mental problems. Now we will see the condition of the mental illness in Pakistan. Mental illness is major health concern in Pakistan with a high prevalence of the mental disorder and limited access to the care. According to WHO, an estimate 50 million people, 1 in 4 people in Pakistan will experience a mental health issue, and 90% of them needing treatment cannot access the support. Pakistan has only approximately 500 psychologists and 400 psychiatrists, with a handful of the child psychiatrists. The 2022 National Psychiatric Mobility Survey found that 35.7% of the people have experienced depressive disorder and 36.6% had experienced neurotic and stress-related disorders. The economic burden of the mental illness in Pakistan for the year of the 2020 is 6.16.9 billion PKR. The burden of the mental disorder by the gender in Pakistan analysis of the GBD shows that the greatest contribution to the daily due to the mental disorder in Pakistan from the depressive disorder, followed by the anxiety disorders. Anxiety was the second highest contributor toward the mental illness. Depressive disorders and eating disorders were quite high in females, whereas the contribution of the autism spectrum disorders and ADHD was significantly higher in the males. Initiatives taken by the Pakistani government has taken several steps to improve the mental health services. The mental health law has been given in 2001 that protect the human rights. Mental health in schools, the government has launched a 5-year initiative to train the teacher to recognize and manage the mental health problem. Mental health and the psychosocial support initiatives, telemedicine, and the health clinic. Prevalence of the multimorbidity in people with and without the severe mental health issues, systematic review and meta-analysis. People with severe mental illness has the comorbidity along with the physical illness. It has been attributed that physical along with the psychiatric multimorbidity prevalence are common in the people with schizophrenia spectrum and the bipolar disease. The greater burden of this physical morbidity in people with severe mental illness reflecting a need for the earlier intervention and importance of facilitated integrated physical and mental health care. MCQs. Number one, a 30-year-old female comes into your clinic and tells you about experiencing excessive anxiety, restlessness, muscle tension, and headache almost every day. She also tells you that she has a trouble at sleep and cannot concentrate at work. Which one sounds the most logical? E generalized anxiety disorder is the right answer. Number second, Ali is suffering from the depression since 2 years and has been prescribed antidepressant. What's the role of the psychiatric medication in the mental health treatment? A, permanently cure all psychiatric condition, replace the need of the therapy. C, help manage symptoms of the mental illness. D, prevent the need for the psychiatric hospitalization. And E, to cure the physical pain. C, to manage the symptoms of the mental illness is the right answer. Number three, you are a public health worker at community. A 35-year-old man named Ali come to you complaining for the persistent sadness, loss of the interest in the daily activities, and trouble sleeping. What is the most appropriate steps in the early management? A, recommend over-the-counter sleeping pills. B, suggest trial relaxation technique and exercise. C, refer early to the mental health specialist. D, he do not need any treatment. C, referring him to a mental health specialist is the right in this option. Four, a young boy of 25 years taking psychiatric department of the Mayo Hospital by the friend after noticing the symptoms of the hallucination, delusion, and disorganizing speech. He was diagnosed to have a case of the schizophrenia. Above mentioned symptoms fall under the category of negative, positive, meditating, catastrophic, or cognitive symptoms. B, positive symptoms is the right answer. There is a social gathering where a guest makes joke about a mental illness that seem to reinforce the negative stereotypes. You want to address this in a constructive way. What is the best approach? A, ignore the complaint. B, confront the guest. C, politely explain why the joke is harmful. D, change the subject and avoid discussion. And E, take him to the hospital for the psychiatric evaluation. C, politely explain why the joke is harmful is the right answer. Six, Aisha has recently been feeling low nearly every day for the past 3 weeks. She has been struggling to concentrate at work and feeling excessively guilty and experienced significant changes. What is the indicative of depressive episode? Fluctuations, increased interest, persistent feeling of the emptiness, temporary loss of the appetite, or increased talkativeness. C is the right answer. A public health agency is planning a series of the workshops on the mental health for the local communities. To for early intervention expanding health insurance. This is the which level of prevention: primary, middle, secondary, tertiary, or quarterly. This is the primary prevention. Eight, a 40-year-old male has been experiencing as a pilot for 15 years. He recently has a pretty scary experience where the engine of his pilot suddenly failed. He has PTSD. But is which statement is true? PTSD increases the risk. This is the correct statement. Number 9, Aisha is feeling irritable and has loss of interest in her hobby. She is also mentioning to have difficulty in concentrating and feeling extremely guilty about the major mistakes she has been experiencing these symptoms for over a month. What should be considered when evaluating her condition? A, the duration and intensity of her symptoms. B, the temporary nature of her symptoms. C, her recent positive change in lifestyle. D, her occasional feeling of irritability. Or E, her marital status. A, the duration and intensity of her symptoms is the right option. Number 10, and a colleague at your workplace is suffering from schizophrenia. She doesn't feel comfortable talking about it due to the associated stigma in a society. According to NAMI, all of the following steps are taken to reduce the stigma related to the mental health. E, be honest. C, don't show compassion. D, encourage equality. Or E, educate yourself. C is the correct option. This is the key to the MCQs. The link to our YouTube channel. Thank you.